Record. Okay, so we are recording right now using Zoom, but we are using Google Meet for our meeting. So this is Zoom. Okay, so good morning once again, class. Hello, good morning. Maligaya ba kayo? Are you okay? Hello? Is everyone okay?
Yes po.
Okay, that's very good. Okay, so I think we're good. Okay, I think we're good. I am now going to show you yung hindi yung PowerPoint kundi yung module because your module will be the basis for your review. For semifinals, I will um, make the examination. Hindi pa ako gumagawa. Gusto ko gumawa ako ng exam pagkatapos ng review para sigurado ako that all the questions that I will be asking had been part of the review. Okay? So, para walang dahilan, para may bumagsak o mababa ang grade, dahil ayaw namin na may bumababa ang grade. Okay? So, let us pray in the name of the Father, and of the Son, and of the Holy Spirit. Amen. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And do not bring us to the test, but deliver us from evil. Amen. In the name of the Father, Son, and of the Holy Spirit. Amen. Magtatanong lang ako, meron ba dito na klase na galing kay Dr. De Jesus? Raise your hand. Meron ba tayo nun? Meron ba tayong option to raise a hand? O sabihin lang, yehey! Dr. De Jesus. Dean De Jesus, meron ba galing kay Dean De Jesus? Wala. Okay. Meron bang galing kay Brother Lester? Galing kay Brother Lester. Oops, wala din. So, sige, kaya na nila. Okay, so hindi na natin problema 'yon ano kung ayaw nila. Okay, so let's talk about gonads. Gonads are actually gland producing organ in the body, okay, that determines the sex of the baby. So let's see what a gonad is. Ganito tayo dapat nagre-review, no? Kapag ka nagre-review, kailangan ay nakaharap tayo sa Google, okay, and tinitingnan natin kung ano ang mga meaning ng mga ginagamit nating salita. Okay? Gonads. Okay, gonads are the male and female primary reproductive organs. The male gonads are the testes and the female gonads are the ovaries. So when we talk about gonads, we are referring to either testis or ovary. Okay? So yan yun, no? And these reproductive system organs are necessary for sexual reproduction as they are responsible for the production of male and female gametes. Now, okay, so when we talk about male and female gametes, these are the uh, sperm or the egg, okay? So let's see if tama yung sinabi ko that these are the sperm and the egg. Okay, so these are the gonads, the ovary, and this one is the testis. Okay, so this is the male and female gonads. Yan. Okay, so gametes. Okay, so we now know that gametes are the egg and the sperm. Okay, so maliwanag yon. When we talk about gametes, they are the egg and the sperm. So they begin the testes or the ovary, as I have already explained, begin to form until about the 8th week of embryonic development. Before that, the baby or the fetus is in the indifferent stage wherein you do not know, you cannot differentiate whether the fetus is going to be a male or a female. So only after the 8th week of development will the external organs of the male will appear. Okay? So, ayun, okay? Mm, mm, may pumasok eh. Na rin natin sa baba ito. Okay. Ito pala. Okay. Admit ko lang ha. Then balik tayo. So the formation of male or female structure depends on the presence of testosterone again. If the chromosome that is received by the egg contains a Y chromosome, then it will develop into a male. If it is an XX chromosome, the development would be that of the female. The embryonic testes release testosterone and the formation of the duct system and the external genitalia follows. So if there is a testosterone, the testis will descend out of the body because it needs somehow a cooler temperature, cooler than the what is needed by the ovary. Okay, that is the reason why it hangs outside the body. I am talking about the testicle. Female embryos that form ovaries will cause the development of the female ducts and external genitalia since testosterone hormone is not produced. So those ducts are inside the body, extending outside the uterus and the fallopian tube and then the ovary. After that, any intervention with the normal pattern of sex hormone production in the embryo results in strange abnormalities. By intervention, this may be accidental, or maybe drug-induced, or maybe experimental, or maybe it is hereditary, that it can produce deviation. I do not want to use the word abnormality. It may produce some kind of deviation in the development of the external genitalia and even the internal genitalia. We have pseudohermaphrodites. However, pseudohermaphrodites have the uh, characteristics of male and female external genitalia. However, the structure or the external structure, so meron nga siyang ari ng babae at meron ding ari ng lalaki. Pero yung external structure na yon, meron nga siyang bayag pero hindi naman ito ma-match doon sa reproductive system, kundi maaaring meron ngang external organ ng lalaki pero ang way of production would be that of a female. So ang default pa rin niya ay the body or the the way a woman would reproduce. Okay. Um, by the way, I would like to close my camera because it's taking a toll on my computer. Magkasabay kasi ang magkasabay kasi ang Zoom ko at ang aking ang aking Google Suite. Okay? So now we are 73. So I am hoping there will be more people. Okay, so that's a pseudohermaphrodite. Um, Pseudo means secondary, no? Pseudo, the word pseudo is a Latin word meaning second, okay? So secondary hermaphrodite or type 2 hermaphrodite, they may have penis and vagina and testicle, but maaari ding magkaroon din sila ng ovary, but only one of the gonads are active, or maybe both gonads are not active. So that depends on how deviant or how different the development of the sexual characteristic is. For a true hermaphrodites, these are individuals who have active ovary and also active testes, meaning to say that they can get pregnant and they can also get somebody pregnant. So these are true hermaphrodites. Now, this is really very rare in nature. Konting-konti lang talaga, but there are people who are hermaphrodites. Pero very rare ito, okay? This is not rare in other organisms, especially animals. There are plenty of animals that are hermaphrodites that they can reproduce on their own. They have both male and female characteristics, like a worm, a snail. Okay, they have male and female characteristics. Even in plants, some flowers have male and female characteristics. But for a human person, hermaphrodites are very, very rare. Now, as I have said, there are issues, no issues regarding uh, assigning assigning gender for hermaphrodites. Issues regarding the assignment of gender for hermaphrodites. The issue arises when the gender is imposed upon the hermaphrodite without these people when these people are not yet capable of choosing for themselves. So, as I have said in my other classes, or kung kayo ngayon lang, there are hermaphrodites that had been assigned uh, female gender because it is easier to assign a female gender to a hermaphrodite because all you have to do is to remove the penis and the testes, and that's it. So that's all you have to do. Pero kapag ang nangyayari ngayon ay they don't feel that they are living who who they really are, okay? They don't feel that they are living who they really are, meaning to say they feel strange in their own bodies, okay? There are there are genders or people who categorize themselves as plural, meaning both male and female. And I think for the hermaphrodites, the true hermaphrodites, these are the true examples of people who can claim or who can legally and maybe probably morally claim that they are both male and female because of the presence of their fully functioning ovary and testes. Okay? So, for them only because iyon yung natural state nila. For other people who wanted to be considered as they or plural in their gender pero iisa lang naman ang gender nila, I think there is a moral question regarding that matter. Okay. Now, puberty, it is the period of life when the reproductive organs grow to their adult size and become functional under the influence of rising levels of gonadal hormones, that is testosterone in males and estrogen in females. So during the time of puberty, when a child is already moving on to another stage in life, this is a halfway. This is halfway between being a child and being an adult. And because this is halfway, all the changes in the body are happening, and there is a higher possibility that a person during puberty may experience some anxieties about themselves or even confusions regarding the roles and maybe even fear about those things that are happening or changing in their body, like the boys having bigger, bigger and deeper and uh, bigger, deeper, and even more guttural voices. The girls may experience their first menstruation, their menarche or menarche, and that anxiety or maladjustment, or not maladjustment, but difficulties in adjustment may happen when there is no adult or there is no proper education given to them prior to the changes that are happening, or that changes that are supposed to happen during puberty. In other words, okay, a lot of changes are happening. Breasts are growing for female, and of course, the internal and external genitalia are growing into maturity so that the size of this genitalia will become more functional to reproduce. Okay, so that will depend, of course, in the release of testosterone and estrogen. So there are people who will develop much faster, or there are people who will experience puberty earlier or much later. That depends on the release of the male or female hormone. All right, so that's it. There are what are those bodily things that are happening? Of course, for female, that is menarche, and male and female, the growth of pubic hair in the armpits and in the groin. Uh, some discharges, okay, in the vagina, and then also for boys, they may have nocturnal emissions. They will experience erections and uncontrollable erections, and maybe they do not know what those erections are for. So those are confused. Those are things that may result in confusion. For the boys, there is a what we call a rite of passage, especially in our country and in other countries that are Christian. The rite of passage would be circumcision. Okay, circumcision. But nowadays, babies are already being circumcised. Para sa akin, kawawa naman yung mga babies na yon. They don't get to enjoy having that rite of passage. Pero para sa akin lang yon. Para sa akin lang yan. Okay? Now, so now we go back to the different diseases associated with the reproductive system. The most common is vaginal infections. It is more common in young and elderly women and in those whose resistance to diseases is low. Vaginal infections can happen maybe because of poor hygiene, and it is highly preventable. Poor hygiene is highly preventable, meaning all you have to do is to become more hygienic. That is to ensure that the vagina is clean and maintained as clean. And then of course, ito ay modesty. Okay, all our sensitivities aside, when you wash or when you wipe your butt after doing your pagdumi or uh, fecal ritual, okay? The wiping should be done away from the genitals, not towards the genital, because fecal matter, even if you do not notice it, fecal matter may enter the vagina or also the penis, and those there are bacteria in the fecal matter sa ating dumi that are not compatible or are not supposed to proliferate inside the vagina. One particular thing is E. coli, no? E. coli can be tolerated in the digestive tract, but it cannot be tolerated inside the vagina, and that can result in infection. So, uh, as was told to me by by my niece, who is a doctor, a girl doctor, the female hygiene, also male hygiene, you should wash your external genitalia regularly, and every time that you urinate, it has to be wiped clean. The boys also will have to wipe it clean. The tip of the penis should be wiped clean also by a small piece of by a small piece of towelette or small piece of tissue paper. Okay, because there is also urinary tract infection that can happen to boys. Okay, and then before going to sleep, both boys and girls should also wash their external genitalia. If that cannot be done, at least wipe it with mild antibacterial wet wipes. Okay, and then of course daily bath. Now, why for elderly women? Because um, as you know, the inside of the vagina should be moist, but for elderly women, there is a drying of the vagina, and the drying of the vagina may cause the flora inside or the good bacteria inside to die as well. Now, if the good bacteria dies, then in occasion where bad bacteria may be able to enter, the good bacteria may not be able to. In the absence of good bacteria, the bad bacteria will proliferate, and that can result in infection. Okay, so it is wise for women to regularly visit an OB-GYN or OB-GYN, OBGYN, an OBGYN for regular checkup. Okay, and then of course, elderly women, especially those who had menopause, they do not have that natural means to clean their reproductive organs from the inside out. Okay, so uh, the and the monthly menstruation is also a way of expelling bacteria, dirt, and impurities inside the body of a woman. Okay. Number two, vaginal infections that are left untreated may spread throughout the female reproductive tract and may cause inflammation in the pelvis and may cause sterility. So buong reproductive organs inside and out magkakaroon ng mga pamamaga, and it may cause sterility because part of that would be the ovary, and once ito ay namaga dahil sa infection, there is a high possibility that once na gumaling ito, the function of the ovary will no longer be restored, and that can result in sterility or inability to produce egg. Escherichia coli or E. coli are bacteria that are found in human feces and maybe animal also. At yun ang sinasabi ko sa inyo, it is okay, it may be tolerated to be inside the digestive tract, but it is not, it is the sex organs, okay, are not supposed to be, uh, the sex organs are not ready to accept, okay, to to be inhabited, okay, to have E. coli as its tenant. Okay, merong ibang bacteria, okay lang, pero yung E. coli, it can cause different types of uh, diseases that are known as sexually transmitted or STDs, such as syphilis, gonorrhea, herpes virus, and yeast. Okay? So again, isang mabilis lang, I know that some of you have already uh, seen what a syphilis is, but there are those who were not able to attend my class because of several reasons. So the bacteria of syphilis is this, okay? So it looks like that. It looks like a worm, okay? It looks like a worm, an alien worm. It's green. And once it colonizes a particular area in your skin, particularly the genitals, it can it can look like this, right? Your palm, okay? These are colonized area, and syphilis bacteria is a type of is a type of flesh-eating bacteria. So once they have proliferated, they are going to start eating the flesh. This is once there is already an uh, uh, once there is already the once the flesh is exposure of the flesh, ito we already call it as canker, okay? A canker. So pagsusugat na siya, magsusugat na, and it might also spread all over the body, particularly the palm, the back of the neck, okay? So these are different parts of the body that can be affected. Of course, the penis and the vagina, the tongue, inside the mouth. There can be sore inside the mouth na pwede ninyong mapagkamalan na singaw. Okay? Uh, once all these things are there, okay, once all those things are there, uh, uh, kaya ako tumitigil, nag-a-admit ako ng mga bagong dumadating, ano? Okay. Once all those things are there, it can already eat your flesh and produce exposure of the make it look like a wound. Okay, okay. Ayan. So balik tayo doon. So this one is already a canker. Kinainan niya yung foreskin. Huh? Okay, so this is true in both syphilis for the male and syphilis for the female. Now, not all syphilis are sexually transmitted. Okay, so mag-iingat din kayo because I think this can be transferred by exchanges of bodily fluid. Kahit hindi kayo nag-sex, kung nahawakan mo yung syphilis at naihawak mo sa organ mo yung ipinanghawak mo sa syphilis, that can cause transfer of the bacteria that you will regret later on. Can uh, a syphilis can have these things. Okay, syphilis is a bacterial infection usually spread by sexual contact. The disease starts as a painless sore, typically on your genitals, rectum, or mouth. Syphilis spreads from person to person via skin or mucous membrane contact with these sores. So, what are the signs of syphilis in man? Okay, in man, usually they occur on or around the genitals, around the anus, or in the rectum, or in or around the mouth. These sores are usually but not always firm, round, and painless. Symptoms of secondary syphilis include skin rash, swollen lymph nodes, kulane, and fever. Okay? Uh, can you get syphilis non-sexually? Ayan yung tanong. Syphilis is a chronic infectious disease caused by the whatever it is, Spirocate, Spirochete, Treponema, Pallidum, whatever. Syphilis is usually transmitted by sexual contact or from mother to infant, although endemic syphilis is transmitted by non-sexual contact in communities living under poor hygiene conditions. So, pwede. Okay, so symptoms. So, balik tayo. So, yun nagkakaroon ba ng discharges ang syphilis? Merong conquers, okay, walang discharges. Tignan natin. Meron, okay? So, for men, there are penile discharge, vaginal discharge. Merong mga parang mga nana na lumalabas, okay? Burning and painful urination, both male and female. Okay? Okay. So, yun lang, naipaliwanag ko naman na to, pero para sa mga hindi naka-attend, at para for the sake of those who are going to who are only going to rely on this review for their knowledge, inuulit ko lang ng mabilis. Okay, so E. coli can result to syphilis. By the way, syphilis, gonorrhea, herpes virus, magkakaibigan yan, magkakabarkada. So once a syphilis is there, there is also a possibility that gonorrhea may develop. Pero ang syphilis ang pinakagrabe dito. Okay, so ito ang itsura ng virus o ng bacteria ng gonorrhea. It while the bacteria of syphilis looks like worms, and these are these looks like two eggs, okay, and with extensions, dendrite like extensions, okay, and they can also uh, populate a certain part of the body, just like that. Okay, it can populate a certain part of the body. um, for the vagina, most common symptoms are those of most lower genital tract infections in women, increased vaginal discharge, dysuria. Hindi ko alam kung ano meaning ng dysuria. Tignan ko lang ha. Hey Google, what is dysuria?
According to Mayo Clinic, painful urination is discomfort or burning with urination, usually felt in the tube that carries urine out of your bladder or the area surrounding your genitals.
Okay, so dysuria is painful urination, okay? Dysuria is painful urination. So the urine is passing through the urethra, and doon magkakaroon ng pain. Intermenstrual uterine bleeding. So there is a spotting kahit na hindi ka kahit hindi ka nagkakaroon ng menstruation, ay mayroong bleeding and menorrhagia. Let us ask Google to help us. Hey Google, what is menorrhagia?
According to Mayo Clinic, menorrhagia is the medical term for menstrual periods with abnormally heavy or prolonged bleeding.
Okay, so abnormally heavy and abnormal bleeding, prolonged bleeding, that is menorrhagia. Okay, so please take note of that. Mahilig ako magtanong ng mga ganyan kahit na ngayon ko lang naalaman. Menorrhagia. Okay, abnormal and prolonged bleeding caused by gonorrhea. Okay, purulent exudate occasionally may be expressed from urethra or Bartholin's gland duct. Okay, so what is purulent exudate? Hey Google, what is purulent exudate?
According to GP Notebook, a purulent exudate is an inflammatory exudate with a high concentration of leukocytes, predominantly neutrophils, dead cell matter and inflammatory molecules e.g. cytokines, lysozymes.
Okay, ito yung these leukocytes, neutrophils, ito yung mga cells, okay, mga panlaban sa infection. Hindi na natin isasama yan. Masyado na tong masyado na siyang medical. Ito urethra, alam niyo na to. Urethra is the tube that carries the urine from the bladder down to the down to the down to the vagina or penis, okay? So this is gonorrhea, okay? There can also be discharge. The discharge may look like this one. It contains all nana or white blood cells, because once you have gonorrhea, uh, the leukocytes, the lymphocytes, those white blood cells are going to are will go to that part of the body that is infected to fight off the infection. So yung mga lumalabas na yan are dead cells, are your dead blood cells, okay? And then another one is, of course, the herpes virus. Okay, herpes. So herpes virus is a skin disease. It is a skin disease. Uh, not all herpes are usually are caused by STD. Okay, but there are herpes that are connected to sexual transmission. Okay, so meron tayong mga herpes zoster, merong herpes simplex, pero pagka yung herpes or yeast na ito ay uh, uh, transferred to the body because of transmission, it can look like parang mga especially in the vagina and in the penis, it can look like that one. Okay, parang whitish colonization. So may mga part ng se- part ng skin that are colonized by it, and it can also cause yung pag pagbabalat. Okay, and then yes, and they are present in most other parts of the body also. Okay, so yan. But again, I would like to reiterate that herpes is not always STD in origin. Okay, sexually transmitted disease. Now with herpes, you can use antifungal cream. Okay, because herpes is a type of fungus. So antifungal cream, you can use it externally. So those are over-the-counter medications. So I'm not saying that nagkaroon kayo ng herpes because of sexual contact. Okay, maring nahawa lang talaga kayo. This is what a herpes looks like. By the way, herpes is virus, no? Ito ay virus, hindi ito bacteria. So this is a virus. So yan, okay? So it can also, no. Okay, so that's what a herpes is. Yeah, it can also cause uh, reddening of the eyes. Okay. Huh? Is there anything else that we need to know? Okay, so herpes magkakaroon ng itchiness, cold sores, genital blisters. Okay. So let's look at the symptoms of herpes. Accept ko na nga. Okay, so herpes results from infection with the herpes simplex virus, HSV. It causes sores or blisters to form in or around the mouth or genitals, as well as other symptoms. Okay. There is what we call HSV1 oral herpes affecting the mouth and surrounding skin, and HSV2 genital herpes, which is usually sexually transmitted. Okay, I'm just taking note also. If a person has an HSV infection, they will have it for the rest of their life, though some people never develop symptoms. If symptoms occur, they reflect the type of HSV. Meaning to say, because this is a virus, this will be uh, part of your body already, pero the body may be able to manage the virus to be inactive, but for the rest of your life, it is already there. There is no cure for herpes, but treatment can help manage symptoms and reduce the likelihood of them recurring. Okay? or yung pagkakaroon ng symptoms. HSV is a common virus. According to WHO, around 67% of people globally have an HSV infection and 11% have an HSV2 infection. Okay? So 67% of people globally meron ito. And you may not know it, maaring you also have this, and that uh, even if you are not sexually active, or even if you have not had any sexual activity, maaari kasi itong uh, maaari kasi itong herpes na ito ay nakuha mo sa iba because maybe you bumped into people with that. Okay. Symptoms: people who develop symptoms of herpes may first experience tingling, itching, or burning, then notice sores or blisters forming around the mouth or genitals. Symptoms tend to develop 2 to 20 days after exposure to the virus. Okay, and then we have oral genital herpes, and then primary symptoms of those: pain and itching, swollen lymph nodes, kulani, fever, fatigue, and general feeling of being unwell. Okay, masama ang pakiramdam, and then pagod lagi. Okay. It will heal, okay, without long-term scarring. Please take note of this. Please take note of this site. Okay. Please take note of that site. I want you to read more on that. Okay. Herpes virus. Okay. And then yeast. Okay, another one is yeast, or a type of fungus. Alam niyo naman, yung fungus, yun yung mga ano sila yung mga parang kabuti, no? Pero fungus, when they grow inside the body or outside the body, it can be problematic. Okay. Yeast. Ayan. Yeast are single cell organism. Alam nyo, ang ginagawa ng yeast or yung fungus, they are scavengers of dead tissues. Okay, dead tissues. So itong mga fungus na ito ay yung mga nabubulok. Gusto niya yung mga nabubulok. Okay, yun ang pagkain niya, and then in a way, yung mga bulok na ito tinatransform ng fungus into something that is good, or something that can be used by other organisms. And it can also be edible, katulad ng mga mushrooms na kinakain natin. But not all mushrooms should be eaten. There are mushrooms that can make you high, such as mushrooms containing psilocybin. Nakaka-high yun. Okay? So, let's look at the images of yeast. Ito yung ginagamit sa pagpapaalsa ng tinapay. So, yeast STD. Okay, so yeast may appear inside. Okay, inside. Oops. It may appear inside the vagina. Okay, those whitish things are yeast, and that can be itchy, and that can result also in that can also result in itchiness and infection. Yeast, and then of course outside the genital organs of the male, pwede dito sa mga pagitan ng daliri sa paa. So ang tawag doon is tinea pedis. Actually, pagka sa balat, ang tawag natin doon an-an. Okay? Ito. So siguro ito yon, mga ringworm yan So ito, an-an yan. Demarcated circle, oval, white. Okay? So if you are going to look at it under a microscope, you will see it. You will see those anan like this. Okay? Now, when it is already inside inside the vagina or around the penis or the testicle, then ayan pa pwede din magkaroon ng is, is this a vagina or a or no, this is dila, okay? This is dila. So these are yeasts. Okay. Other than that, we have a very common type of of sexually transmitted disease, both from for male and female, and that is known as chlamydia. So hindi na isulat dyan, pero please take note, chlamydia. This is very common. Ito ay tulo, okay? Tulo. So once you have chlamydia, pwede ka magkaroon ng tulo. That kind of tulo is clear. It is clear. Yeah, I think it's clear. This chlamydia is bacterial. It is not chlamydia is bacterial. Okay. Ano yung viral? Ano yung viral? Anyone? Okay, may nagano. Joshua Perez, yes, antifungal cream ang gamit, okay? Para sa yeast at para sa herpes. Katulad ng Canesten, yan, antifungal yan. But then of course, you have to see a urologist or an OB-GYN para tignan, or kahit na family doctor para mabigyan ka kung kailangan mo ng oral medication. Okay, so yan. Chlamydia, going back to chlamydia, this is penile discharge. Magkakaroon din ng vaginal discharge. As I've said, the penile discharge is usually, kung doon sa gonorrhea ay parang nana, dito naman ito ay it is clear. It looks like pre-ejaculates. And then it is burning. There will also be yung burning and painful urination. Ano ang tawag natin doon? Sa ano ang technical term or scientific term? Tatandaan ninyo? May gustong sumagot? Nakalimutan na? It is known as dysuria, ano? Dysuria. D-Y-S-U-R-I-A. Dysuria. And then pamamaga ng bayag, and then bleeding between periods, ito yoon na nagkakaroon ng spots, okay? Nagkakaroon ng spots. So tingnan natin yung how prevalent these are. So we have HIV. This is the most this is the deadliest. Of course, you know that HIV can lead to AIDS, okay? And there is no cure yet for HIV and AIDS, okay? And then yung HSV2, ito yung type ng herpes that is this is the type of herpes that is manifested in the genitals. Okay, so ayan. Okay. Chlamydia, okay, gonorrhea, syphilis. So, ang mataas ang prevalence ay syphilis. 51 to 64% per sexual act. Ito si gonorrhea 60 to 90% per sexual act. Balik muna tayo dito, tanggapin ko lang yung okay. So that's chlamydia. nakita okay, it can also lead to this painful ejaculation, painful intercourse, as I've said, penile discharge, and then inflammation of the, maybe not just the testicle but also the penis, and then spotting in women. Kahit na hindi nagme-menstruation, maaaring magkaroon ng blood. Okay? It can also spread in the mouth and in the eyes. Okay? Yeah. Talampakan. They are developing vaccine for chlamydia. Pero the most effective way to prevent chlamydia is for you not to engage in sexual activities, okay? And once you get married, sexual activity only to your husband or to your wife, okay? Okay, I think that's about it for chlamydia. So how do you spread chlamydia? It is transmitted by sexual fluids through oral, vaginal, or anal sex. It is curable. 70% of women and trans men don't have symptoms, but they can, tandaan ninyo ha, kahit walang sintomas ng chlamydia, they can transmit, okay? Because chlamydia is a bacteria, it can be transmitted. Did you know chlamydia is the most commonly reported STD in the US? Okay, so yan. Okay, I think we have it already. So chlamydia is for both male and female. Okay, another disease associated with the reproductive system, painful or abnormal menses. So pagka painful, it can be because of hormonal imbalance or infection. Mayroong nag-share na estudyante na hindi daw dapat, saka yung pamangkin ko sinabi hindi dapat laging iinom ng paracetamol or Buscopan because if it is caused by hormonal imbalance, then uh, the pain in your menstruation should be treated by way of balancing the hormone. All right? So merong mga gamot doon katulad ng pag-inom ng contraceptive pills, but wag kayong basta iinom because it has to be determined by your OB/GYN na kung anong klase ng combination or whatever it is, yung OB/GYN ninyo ang nakakaalam noon, not me. Okay? And kahit babae kayo, hindi nyo rin alam yan. Kahit huwag kayong umasa kay Dr. Google, ha? So, Google can only help you to a certain extent, but the doctor will be the ones who will be able to help you more accurately. Okay? Now, it can also be caused by infection. So, again, OB/GYN yun. So kung talagang huwag kayong masyadong mag-iinom ng mga pain meds because pain medications can increase your tolerance sa your body may increase tolerance in pain medication. So baka pagka yung talagang may mga matitinding pain na kayo, hindi na gumana yung mga pain medications. Then another and this is deadly disease for women, breast cancer and cervix cancer. Okay. So you know what breast cancers are, cervix cancers. So ito yung pangkaraniwang nangyayari sa babae. There are growth in the breast and in the cervix that are maybe it will start with what we may say infection, and then it can become cancerous, all right? Pasensya na kayo sa ingay sa labas, ha? Okay. I hope hindi ninyo masyadong nadidinig. I am not the only person living in this house. Sana makapagpagawa na ako ng sarili kong studio. I am thinking of building my own house. But in the meantime, I was able to build my own solar panels here. Kaya 24 hours na ang aircon natin. Okay, and wala na tayong carbon footprint na idinadagdag sa atmosphere. Okay, so tumors of the breast and cervix, ito po pwedeng tanggalin yung breast. So, meron mga tinanggalan ng mga dede at sa cervix naman kasama doon yung uterus. Siyempre, hindi na ito po pwedeng manganak and then it is followed, pagka tinanggal yan, it will be followed by chemotherapy para yung mga natirang cancer cells are killed, okay? So, all those cancer cells are killed. Hindi na ito kakalat. But then, even when that happens, pwede pa din na ikamatay mo ang breast cancer or cervix cancer. Ang katumbas nito sa lalaki, prostate cancer, which we are going to talk in a minute. Okay. Now, what are the common conditions for male? Prostatitis, urethritis, epididimitis, and orchiditis. Sila ay, again, magkakabarkada at pagka lumakad yan, ay ayaw magpaiwan yung iba. Okay? So, pagka nagkaroon ka nito, maaari magkaroon ka ng isa, maaari magkaroon ka ng iba. Okay. Katulad ng epididimitis, pagka ang epididimitis, maaaring pagsimula ng orchiditis or orchitis. Okay? Yung urethritis, maaari ding mahawa ang prostate. So, nagsasama-sama yan. Urethritis can also cause epididimitis. Now, for those who are not here in my lecture, I would like to show you once again what these are. So, umpisahan natin sa prostatitis. Okay, tandaan niyo when the excuse lang ha, medyo talagang naiingayan ako eh. Okay, so ayan, na hindi pala nila alam na tuturo ako. So, pasensya na kayo. Okay. So, prostatitis, you know what a prostate is, right? This is only in men, okay? Kung ang babae ay mayroong uterus, kung ang babae may uterus, mayroong breast, no? Wala naman ng lalaki, pero meron ang lalaki na prostate. Ang prostate, guys, ito yung gumagawa ng semen, okay? Ito yung tagagawa ng liquid kung saan doon lumalangoy ang mga sperm, okay? So, pag nag-ejaculate tayo, we are actually ejaculating the liquid that is produced by this, okay? By this, okay? Yan. This is a normal prostate dito, no? So, this is a normal prostate. This is the one that produced the liquid or what we call semen. Okay? I'm not sure kasi pagka sinabi nating semen kasi kasama na dun ang sperm cell. So, we just call it that liquid component of the semen. The liquid component of the semen. So, that is, okay? So, dito, yan ang nagpo-produce. So, importante yan. It is located at the base of the bladder. It is located at the base of the bladder. At ito ay nakabalot sa urethra. Ang urethra, ito yung dinadaanan ng ihi, babae may urethra din. Okay, ganyan din ang ganoon din ang biology, ang anatomy sa babae, no? Kapag puno na yung bladder, mag-o-open ang urethra, ang bladder, ito yung pinakapuno ng bladder at dadaan dito. So with a normal size of the prostate, makikita ninyo that there is enough room for the urine to flow strongly. Pero kapag ka namamaga, ito 'yon, no? Sabi natin lahat ng nagtatapos sa itis, pamamaga, maybe because of infection katulad ng appendicitis, tonsillitis, urethritis, arthritis, 'yan, mga pamamaga, okay? So dito pagka namaga, maiipit yung urethra at mahihirapang umihi. Now, ganun din sa may prostate, okay? Sa mayroong enlargement of the prostate, hindi lahat ng enlargement of the prostate ay prostatitis. Meron din tayong tinatawag, lalo sa mga may edad na nagkakaroon ng natural growth, okay? Enlargement, hindi iyon caused by, that is not caused by sexually transmitted disease. It is a natural occurrence in some older men that the prostate is becoming enlarged, okay? Growing bigger than it should be. So nangyayari ay nagkakaroon ng hirap sa pag-ihi. So nagkakaroon ng pagka yung puno ang bladder, dire-diretso yung ihi ni lolo, ni tatang, okay? Pero kapagka dito na yung level, so mahina na yung pressure, pa-squirt-squirt na lang ang nangyayari. So makikita ninyo, papatak-patak o kaya ay pa-dribble-dribble ang ihi. At kapagka wala na, dito na lang talaga yung natitirang urine, ay hindi na mailabas ni tatang o ni lolo. Kaya kahit na ang tagal-tagal niya sa CR, pinipilit niyang lumabas kasi gusto niyang ma-empty yung bladder niya. Ang tawag dito, ang tawag doon sa ganong condition, nandito rin sa inyong, nandito din sa inyong module is prostatic hypertrophy, but this is more commonly known as, okay, dagdagan natin, or BPH, which means benign. Pagka sinabi nating benign, hindi siya dangerous, okay? Benign, mabait yon. Prostatic hyperplasia. Okay. So prostatic hypertrophy or BPH, benign prostatic hyperplasia, usually this is the more common term. Okay? This is the more common term. Benign prostatic hyperplasia. It can happen in men older than 40 years old and above. Okay? 50% of males would have this problem. And it can become cancerous. Pero hindi lahat ay nagiging cancer, just benign lang. So, paano malaman kung ito ay cancer na? Of course, you are going to, you have to see a urologist, okay? Ang prostatitis, it can be caused, balik muna tayo sa prostatitis, it can be caused by infection, infection that is caused by sexually transmitted microorganisms. So, maaari magkaroon ng infection yan. So, yan ay ginagamitan ng, siyempre, mga antibiotic pagka mga infection. Okay? And then, kapag nagka-infection dyan, dahil magkatabi lang ang prostate at urethra, maaari ka rin magkaroon ng urethritis, which is pamamaga naman ng tubo kung saan lumalabas ang ihi. Okay? Urethritis. And pwede din ang urethritis ay makuha sa UTI o mga pagkain ng mga maaalat. Okay? At hindi pag-inom ng sapat na tubig. So, pwede kang magkaroon ng urethritis. Okay? And then, dito naman, ito yung sanga na yan, papunta ito sa testis. Ito, papunta sa testis. Epididymis ang tawag dito. So ito, kapag ka naman namaga, ang tawag dito ay epididymitis. Pero bago tayo pumunta doon, punta muna tayo, tapusin na muna natin yung prostate na yan. So kapag ka matanda na at na-detect ng urologist na maaari ka may prostate enlargement, so ginagawa dyan ay digital, by way of digital digital examination, meaning to say the daliri, okay, the finger of the doctor. The doctor will insert his finger and try to try to feel the size of your prostate gland. Okay, so this is the uh, pinaka less invasive at saka pinakamurang paraan at safest na paraan para malaman kung nagkakaroon ka na ng enlargement of the prostate. My advice is that once na edad ka na ng mga 40 at napansin mo na nahihirapan ka ng umihi, you go to your urologist and ask for a prostate examination. Now, pagka nakita na yung prostate mo ay malaki, okay, meron ka ng prostatitis, yan, or benign prostatic hypertrophy or benign prostatic hyperplasia, ito ay ipapa-ultrasound para malaman kung gaano kalaki. At pagka talagang malaki siya sa normal, okay, ito yung pagka yung talagang mas malaki siya sa normal, pagka mas malaki siya sa normal, ito ay pagkatapos ng ultrasound at nakitang malaki sa normal, kukuha na ng tissue, okay? Kukuha na ng tissue para ito ay matignan for biopsy, titignan kung ito ay cancerous. Okay. Yan So kumukuha na ng tissue dito. Okay. Endorectal ultrasound pala to. So para mas meron talaga kasi yung ultrasound na pangkaraniwan dito lang sa tiyan, okay? Makikita na yun ang prostate, makikita na yung size ng prostate. So there is another type of ultrasound which is more accurate, ultrasound, endorectal ultrasound. So ipapasok ito inside, pero dito lang sa inside the rectum lang. Okay, inside the rectum, walang hihiwain sa inyo. So yan, at mas malapit ang magiging measurement. Okay, I think this is going to be more accurate. Okay, and then of course yung biopsy kukuha ng ito yung rectal exam, ito yung sa finger lang, ito yung pinaka-common. Okay, ito yung pinaka-common. So huwag kayong mahihiya because this is a medical procedure. Okay, and then of course there is another thing, you can have your PSA tested. So pagka nakita na by ultrasound malaki talaga, the doctor will order PSA testing. That is the presence of prostatic specific antigen in your blood. So if there is a high degree or high number of PSA in your blood, then there is a higher probability that you already have prostate cancer. And once that happens, the you should undergo removal of the prostate, and the removal of the entire prostate should be removed. Okay, and that you will have to go through series of chemotherapy para yung mga natira. So tingnan niyo yung prostate niyo. This is the normal. Ito yung cancer, nagkakaroon ng mga parang spots right there. Okay. Okay. So yun kay mga lolo at lolo. So this is the normal, this is enlarged. Yon. So ang tawag doon basta enlarged lang at hindi naman cancerous, it is benign prostatic hyperplasia or prostatic hypertrophy, which is in your notes. Okay? So may nakalimutan pa ba ako? Ito is a very high a very it is really a killer for older adults, okay? For adult males, a killer for many adult males that have prostate cancer. So, yan. Ba't ngayon lang pumapasok itong mga ito? Or nawawala? Okay. Okay, so Again, balik tayo dito. So, although aging men show a steady decline in testosterone secretion, the reproductive capability seems unending, meaning to say that with women, after the end of menstruation cycles, no, after after menopause, which happens at a certain age in women, merong mga nagme-menopause ng 50 or 60. Wala yata, baka 60 yata, hindi na umaabot eh. Pero meron pa rin mga ano, meron pa rin siguro na hanggang 60 pwede. I'm not really sure about that. Pero meron mga as young as 40 nagme-menopause na. So, yun, pagka nag-menopause na, hindi na pa pwedeng magkaanak. Pero yung mga lalaki, for as long as they can have an erection, kahit na gaano katanda si lolo, kahit 175 years old na yan, pwede pa rin sila magkaanak. So the reproductive capability seems to be unending for male, but that is not true for women. Erogenous zones, these are parts of the body that are receptive for stimulation during sexual intercourse, and it can arouse you sexually when touched, of course, in a sexual manner. The mouth, the breast, the genitals, the anus, and other common areas that can be aroused may include the neck, the thighs, the abdomen, and the feet. Of course, syempre, pagka hindi sexual manner, it will not increase the sexual arousal katulad ng neck, ng thigh, abdomen, saka ng feet. How will it increase your arousal kung minamassage lang naman? Pero ito, syempre, mouth, breast, genitals, medyo mas mataas ang sexual arousal dito. Ang tawag dito are erogenous zones, okay? Now, regarding human sexual behavior, we have what we call solitary, between two persons or in a group that induces sexual arousal. Solitary may include masturbation. Um, it may also include fantasizing about having sex. Okay, that's solitary. And then between two persons, between a man and a woman, between a man and a man, between a woman and a woman. Okay, or in a group, between a man and two women, or between two women and a man. Or a group. That depends on the kind of society where you live in, and the acceptability of that kind of behavior, and maybe also the time or the age. Okay, right now I am watching a Netflix series, yung Vikings. At doon nakita ko na yung mga taga Norway during that time, in the ancient times, it's okay with them yung mga sharing of women, or one woman and then two men, ganon. Okay sa kanila yon, it is considered normal. There is nothing morally wrong para sa mga Norwegians or mga Norsemen, okay, sa mga Vikings noon. So depende sa time, and depende din sa kultura ng tao at saka sa religion nila. Okay, for us Christians and Muslims, okay, and Jews, that is immoral. Okay, so sex can only happen between two persons who are married, okay, religiously and legally married. So we have also some determination regarding our sexual behavior. Whether we are going to lean towards heterosexual, that is between two persons of opposite sex, or homosexual, between two persons of the same sex, or maybe bisexual, either sex, or ano pa ba yon, yung sa bata, pedophilia, an adult towards an adult towards a child, pedophilia. That can be inherited, and that can also be maybe determined by your psychology or the way you had been raised. So it is still a mystery how a person become heterosexual or a homosexual. Hindi pa rin natin alam yung talagang 100% dahilan kung ba't nagkakaroon ng homosexual at gano'n, no? And there are theories that normal ang heterosexual because yun ang pinakamarami. Pero pagka naging mas marami ang homosexual, hindi na normal ang heterosexual. So what is the definition of normal? Ang nangyayaring definition natin ngayon is kung sino yung nakararami, yun ang normal, okay? But that is not me, ha? Hindi ako yung I'm not talking about my own opinion. That is a developing opinion right now that what is normal is the greater number of people. Hindi laging tama iyon, okay? Of course, we have sex. Sex is important in order to ensure the survival of our species, for the to ensure reproduction. And then, of course, the way we exercise it would be dependent on the degree of restraint imposed by the society and religion towards the individual. Okay, towards the individual. Okay. Let me just accept. May pumasok. Rika May. Okay. So let's move on. Okay. Types of behavior. Solitary behavior. So when you masturbate, that is self-gratification. You are self-stimulating. You are stimulating yourself to the point of sexual climax or sexual climax or ejaculation or orgasm. Okay. And that it can be an end in itself. Pagka yung solitary behavior, you may say that it is an end in itself, meaning to say that you are doing it only for the pleasure that masturbation can give you. Pero tandaan natin, sex is given to us by God in order to give pleasure and express love to your partner, to your husband or to your wife, and then also to uh, to beget children. So that is the twofold reason for us having given the gift of sexuality or sex. So, yan. So, self-gratification is most frequent among the unmarried. There are more males who perform acts of self-gratification than females. So, siyempre, kapag unmarried ka, at lalo na pagka bata pa, mas madalas ang self-gratification or masturbation. At more common ito sa lalaki than babae. Okay? Pero marami din babae na nagkakaroon ng ganitong activity. Okay, number 2, sociosexual behavior. Heterosexual behavior is the greatest amount of sociosexual behavior that occurs between only one male and one female. So ito yung pinaka major type of sexual behavior, heterosexual, meaning this is exercised by a greater number of men and women. Okay, people, greater number of people. Okay, and that is why we consider this as the norm or the normal. Okay, it usually begins in childhood and may be motivated by curiosity, such as showing or examining genitalia. So our curiosity regarding our sexuality may begin in childhood. Bakit ba ako why do I have bird and why does she have a flower? Okay, so maybe two kids maybe comparing notes. Okay, comparing what they have with each other. So interest yan, curiosity. Physical contact involving necking or petting is considered as an ingredient of the learning process. This is maybe necking or petting. yung mga kissing, embracing, holding hands, those are physical contacts that may be classified as necking. Okay. Petting differs from hugging, kissing, and generalized access. Okay. Petting, because yung petting, when you say petting, you are already touching the genitals of the other person. Okay. So necking is more of yon, holding hands, hugging, kissing, and well, caresses like hinahagod ang buhok. Okay. Yung mga showing of affection. Okay, that is necking. Pero pag petting na, ibang klase na yon. That is touching the breast, touching the genitals already. Coitus is the actual act of the actual sexual act that can result in reproduction already, that can result in one person or that can result for the woman to become pregnant. Okay. Okay, so coitus should be done in the state of marriage. Okay. uh okay, that's it. As much as possible, and it should be done actually talaga in the context of marriage lang. Okay, especially for us who may be Christian or Muslim or Jews. Okay, so sinasama ko na ang mga Hudyo kung meron akong estudyanteng Hudyo. So yan, magkakatulad tayo ng pananampalataya at moralidad tungkol sa sexuality. Kristiyano, Muslim, at mga Hudyo. Okay. Okay. So this has been discussed, the physiology of human sexual response. It was discussed in module 5, but let me just go through it quickly. So this is a result of the observation done by Masters and Johnsons, wherein they observed about 600 or 700 individuals having sexual activity. So nakita nila that it follows a certain cycle. The first one would be the excitement or yung arousal, wherein the person may have an increased pulse and blood pressure and the skin temperature, and then nagkakaroon ng flushing and swelling of all distensible body parts. Okay, swelling meaning to say that there will be swelling of the vagina and of the penis, so they become engorged. Symptoms of arousal eventually increase to a near maximal physiological level that leads to the next stage, the plateau phase, where it is very near orgasm. The penis is fully engorged. The vagina is receptive to the thrusting or receptive to the penis, and of course the vagina also is fully lubricated. Okay. uh, and then followed by the sexual climax, which is the orgasm, felt by the entire body, by every fiber of your being. uh, and then the resolution, the last stage, that refers to the return to a normal or subnormal physiologic state, wherein the normal, okay, balik sa normal, or for younger boys, subnormal physiologic, they are still erected but not fully erect. Okay, that's the resolution phase. and then there will be a what we call this is not part, but we can include that ano nga tawag dito, the time that is needed for you to be capable once again for sexual action, the refractory period. The time it takes for you to be able to have sex once again. Okay, so that's the refractory period. So this ends our nervous system pa pala. Okay, can we sir, ano po ba ang dahilan bakit nagiging cancerous? Nagiging cancerous ito, yung bang prostate, okay? So, pwedeng maging cancerous, depende sa abnormality ng growth ng cells. So, pagka nagkaroon ng abnormal growth ng cells, yung matitigas at uh, uh, it continues to multiply, palaki ng palaki yon. Pagka ang cancer kasi nagmumultiply siya, lumalaki na lumalaki, that is cancerous already. Usually, a cancerous prostatic hyperplasia is inherited. Okay? So if there is someone in the family, there is a bigger chance that you will inherit the disease of being cancerous, of it being cancerous. All right? So I would like to ask for a short break. Medyo napapagod na ako. Kailangan ko lang mag-CR sandali and then uminom ng konting tubig. Mga 5 minutes lang, guys. Just a short break, please. Stay there. So, nervous system factors. You already know that we have our nervous system consists of the central nervous system and the peripheral nervous system, and that our central nervous system is composed of the brain and the spinal cord, and then we have the peripheral nervous system, which is divided into the somatic nervous system and the autonomic nervous system. Now, it is the autonomic nervous system that is involved in controlling the involuntary responses of the body. So we have that digestion, heartbeat, breathing, those are controlled by the autonomic nervous system. Now, we have this autonomic nervous system also to thank for in regards the our sexual activity. Particularly, we have the uh, sympathetic nervous system and the parasympathetic nervous system that are responsible for the stimulation of our sexual desires and sexual responses. The thalamus and the hypothalamus and the entire limbic system. Remember that in our discussion in Module 5, that entire limbic system is the emotional part of the brain. It processes the limbic system processes all of our emotions, fear, love, desire, anger, etc., etc. And our sexual response is actually regulated by the limbic system, not just the hypothalamus. We have the ventral tegmental area there. We have the septum. We have the thalamus. Okay, and all those parts of the brain are contributing to uh, the way we respond sexually. The lower spinal cord leads to erection and ejaculation for male and vaginal discharges and lubrication for female when the genital and perineal areas are stimulated. Why the lower spinal cord? Because it is the closest part of the central nervous system to our reproductive organs. Okay? Now let's go to sexual problems. Hindi ako hindi ko na ito I am not ano ba tawag dito? I am no longer explaining in detail because we have already done that, been there, done that. This is just a review. So when we talk of physiological problems, this has something to do with sexual problem that is caused by some diseases of the body, okay, or abnormal development. So maybe if you have some kind of disease, like let's say for example, you had an abnormal development of the genitalia, then your sexual response may be debilitated or limited, okay, or maybe you may have diseases that can diminish your libido. Diabetes, I know, and hypertension, yung mga medications for that, for hypertension, mga beta blockers, once you are taking that regularly, can diminish your libido, and that is in a way related to physiological source for sexual problem. Okay, so and then there is also neurophysiology, that is the brain. Okay, the physiology of the brain has a problem. There is a problem probably in your septum. The septum, I think, if I remember correctly, is the part of the brain that which seems to be responsible for ejaculation or for orgasm. Okay, so psychological problem, on the other hand, may be you may induce inhibitions. Pag sinabi nating inhibitions, ay yung mga hindi, parang pakiramdam mo hindi mo kayang gawin or kinahihiya mong gawin. Okay, so induced inhibitions like nahihiya ka, ikinakahiya mo, o kaya naman ay pinandidirihan mo ang ang anything that is sexual. Maladaptive attitudes, natatakot ka, maaaring tinatakot ka noong bata ka, wag kang lalapit sa lalaki, mahawakan ka lang ng lalaki, mabubuntis ka. So that can result in a psychological problem. Ignorance and sexual myths held by society, uh, you know, yun, mag-masturbate ka, mabubulag ka, o kaya mababaliw ka, okay, yung mga ganon. Wag kang maliligo kapag ikaw ay mayroong wag kang maliligo kapag meron ka, dahil papwede kang pwedeng maging dahilan ito ng pagkabaliw, okay? Yung paliligo pagka meron, okay? Maraming mga psychological problems, the feeling of inadequacy, or the feeling that you are incapable of satisfying your partner, may result in a abnormality in your sexual attraction. Okay, most common of it would be pedophilia. So dahil natatakot ka na sa tingin mo ay konti ang kakayahan mo, limitado yung kakayahan mo to satisfy your sexual partner, ang nagiging fixation ay bata, okay? Bata. And then we have premature emission of semen, which is very common among younger boys. And then erectile impotence, which is common in male who are a little older. It may be caused by, of course, diseases na nagkakaroon na ng mga sakit na related sa pagtanda. Okay? Erectile impotence, pwede din that erectile impotence can be psychological, that you are afraid that you may not be able to perform well, and your anxiety prevents you from having or sustaining an erection. Okay. Ejaculatory impotence is the inability to ejaculate or reach orgasm. Okay. this is not common, and this can be psychogenic in origin. The word psychogenic is just another word for psychological. Vaginismus or vaginismus is a strong spasm of the pelvic musculature constricting the female reproductive organ so that penetration is painful or impossible. Okay, so you know that the uh, vagina, inside the vagina, it consists of folds that expands during the sexual or encounter, and it expands even more so of during the time of giving birth. Okay, so yan, mas malaki ang expansion niyan. Okay, and then we have sexually transmitted diseases, and I would like to talk about this more. We have already talked about chlamydia. By the way, these are bacteria, virus, or parasites that can infect a person through sexual contact or maybe non-sexual kung minamalas tayo. Okay? Okay. So, ang schedule ko is 10 to 1 sa inyo, but the problem is yun nga, nawalan kami ng kuryente. So I will just continue. Dire-diretso ko to. Then meron akong 2 to 5 and then meron akong 5 to 8. So pwede kayo magpabalik-balik. Okay? Chlamydia, we have already discussed what chlamydia is. This is the most common. And most of the times, chlamydia may resolve in itself, but sometimes it can result in more severe infection. Gonorrhea and syphilis seems to be the same in manifestation. Okay, but then gonorrhea is viral, syphilis is bacterial, cancroid ito yung mga ulcers. Okay, cancroid. These are the types of uh, these are the types of sugat. Okay, so tingnan natin ng cancroids. Okay, so yun nga, pagkakaroon ng mga sugat-sugat, pagkakaroon ng mga yan, okay, around the penis, and not just the penis. Okay, basahin lang natin to. Cancroid is an infection caused by bacteria and is a type of sexually transmitted disease that results in open sores on and around the genitals of both men and women and men. Okay, so cancroids are bacterial in origin. Oops. Paano nangyari to? Okay. By the way, inguinal lymphadenopathy, ito yung parte ng pusona, inguinal. Okay? Dito yung parang merong mga nababanat dito. Balikan ko na lang. Okay. So cancroid is a bacterial condition that causes open sores on or around the genitals. It's a type of sexually transmitted infection, which means it is transmitted through sexual contact. Okay, rarely seen in the United States. Images, balik tayo sa images. These are the types of images that you will see in a person with a cancroid. Okay, this is the type of bacteria. This is what the bacteria looks like, para siyang longganisa. Okay, and it is a flesh-eating bacteria. Look at this one. It is a flesh-eating bacteria. Kapag nangingitim na yan, ibig sabihin there is already necrotizing effect. Okay, patay na yung cells na ito. So the only thing that you can do that is for you to for the doctor to remove the dead cells. Okay. 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 Kanina nga pala, no, konting balik lang tayo. I discussed urethritis, prostatitis. I also discussed epididymitis. I forgot to discuss epididymitis and orchiditis. So, nalagpasan ko yon. So, balik lang tayo ng konti dito. Konting backtrack lang. Pasensya na kayo. So, yung epididymitis, okay. Ito yung tube, okay? Ito yung tube na nakabalot sa testis, okay? Sa mismong itlog, okay? Sa mismong itlog, ito yung tube na siyang dinadaanan ng sperm, okay? Sperm na sasama doon sa sexual liquid na ginagawa ng prostate dito. So ito yung epididymis, okay? Ito yung epididymis, okay? And then so ito siya yung malaki, then yung maliit na part ng epididymis, ito na yon yung vas deferens. Papunta siya dito sa prostate gland, susundo kukuha ng semen, okay? Kukuha ng liquid component ng semen, okay? Kukuha ng liquid component ng semen para ilabas through the urethra, okay? Now, ang epididymitis, kapag ka nagkaroon ng infection, ito ay namamaga at ang pakiramdam nito parang binabanat, parang gustong putulin, parang malalaglag yung mismong testis or yung itlog. Okay, po pwedeng isa lang sa mga itlog o maaaring parehong itlog ang madamay. Now, ang epididymitis, okay, an epididymitis can progress into orchitis or orchiditis. The more common term is orchitis, which is the swelling not only of the epididymis, but the swelling of the testicle itself, okay? The entire testicles, okay? Okay, both the testicles. So ito yung labas, okay? You will see that there will be swelling also in the scrotum. Yung scrotum, yun yung balat na bumabalot sa testes, okay? So yun yung nakikita natin yung gustong-gustong pagka kinakamot ay kinukurot. Okay, so so what happens with orchitis? There can be an inflammation or infection of testicle, swelling, pain, tenderness, erythema, and shininess to overlying skin, spread of epididymitis, hematogenous post-viral. Yun, the reason is the spread of epididymitis. So nagkakaroon din ng infection ito, nagiging shiny at tender, and of course painful ang scrotum, okay? So let's see what the Mayo Clinic has to say regarding this, okay? So you have to learn this. Let this serve as a warning for everyone para hindi natin binabaliwala ang orchitis. So you can see that orchitis or orchiditis can be a result of the progression of epididimitis, and that not seeing a doctor, not treating it may cause death, may cause septic shock because the bacteria that is in there may spread all throughout the body. That is sepsis, and it can cause loss of both testicles kung kinakailangan tanggalin, or if it is really very severe, it can cause death. Okay? So, wag nating baliwalain. That is only what I am trying to say. Wag baliwalain ito. Okay, so going back, so nakabalik na tayo. So we have concroid, and this is source that you are going to have in your genitals, and then HPV or human papilloma virus. Okay, HPV. Ito na yung mga warts, no? Pangkaraniwan, ang mga babae binibigyan ng bakuna para sa HPV. Okay? Pero po pwede rin magkaroon ng warts ang mga lalaki. Pangkaraniwan nga nangyayari dito, ang lalaki ang carrier tapos ang babae ang nagkakaroon. So, I am not sure kung bibigyan ng bakuna dapat ang lalaki, pero ang na-develop na bakuna ay para sa mga babae. Okay? Parang nagluloko yung internet ko. Human papilloma virus. Ayan. So, this is a viral infection, and you need a vaccination in order to prevent this. This can result from this. Okay. So, two individuals having sexual activity could transfer HPV infection. Okay. And then it can result in cervical. It can give you cervical cancer. Cervical cancer, that is cancer in the cervix, of course. That would include everything inside the reproductive system inside, and cancer in the anus, vagina, and the vulva. The vulva is that part of the vagina where sexual intercourse is being done. Okay? It can also cause cervical cancer, and then genital warts, yung mga anong tawag doon sa warts, Tagalog, kulugo. Okay, yan. If you are young and you are strong, then your body may be able to clear the infection by itself. But in order to be sure, kailangan mo na magpabakuna, human papilloma virus. Tandaan niyo, it can cause cancer in the pelvis. Okay? So that's the reason why mas malaki ang epekto nito sa babae, and that's the reason why it is advisable for women, especially the sexually active, to have a vaccine, to take a vaccine against HPV or human papilloma virus. Okay. So, ayan, pagkalat ng mga kulugo. And look at this. This is one of the worst cases na nakita ko for human papilloma virus. Na-cover na yung buong kamay niya ng kulugo. Okay? Parang hindi na kamay. Hindi lang babae, lalaki din. Okay? So yan, itong kulugo na ito, maaaring maging ganito. Okay? Maaaring maging talagang parang puro kulugo na talaga. Then there can also be kulugo inside na mapagkakamalan mong singaw. So treatment or prevention would be, of course, vaccination. vaccination. Now, if you are not, if you know that you are not going to be, if you know that you are not going to be sexually active, then you don't need vaccination. Okay, so this is pelvic cancer, and this is the cancerous cell. So the with HPV, yung mga kulugo ay dito na tumutubo around in any part of the pelvic area. Okay, so this is already cancer. There you go. Okay, any question regarding this part? So herpes simplex, pinag-usapan na natin to kanina. Trichomonas vaginalis. Okay, so this is what is this, viral or bacterial? Tignan ko muna. It is parasite. It is a parasite. Okay. Trichomonas vaginalis is anaerobic, meaning ano nga ba yung anaerobic? Anyone who knows? Anaerobic. Anaerobic. Anaerobic infection. Okay, ito. Anaerobic bacteria are they do not oxygen is fatal to them. Okay. Anaerobic bacteria differ from aerobic bacteria in their oxygen requirement. Oxygen is toxic to anaerobes, which can be explained by the absence of enzymes. This is an anaerobic bacteria, meaning to say that they will be killed if there is sufficient oxygen. Okay? So yun lang yung tawag doon. Pagka they don't require oxygen, toxic sa kanilang oxygen. So Trichomonas vaginalis is the presence of these parasites, okay, anaerobic parasites in the vagina. Okay. So ano ang tingnan natin kung may makikita tayo na symptoms dito. Ito parang isda ang itsura ng parasites na to. Trichomonas vaginalis, also known as trichomoniasis, is a curable sexually transmitted infection or STI caused by a parasite. Trichomonas vaginalis, the majority of infected individuals are asymptomatic, meaning they do not present any symptoms, making diagnosis difficult. Therefore, appropriate treatment and prevention strategies are important to prevent its spread. Ano pa sinasabi dito? Okay. TB or Trichomonas vaginalis is the most common non-viral sexually transmitted infection. Most common, with an estimated 276.4 million cases worldwide in 2008. Okay, transmission. sexually, siguro, ayan, through sexual intercourse and requires intravaginal or intraurethral inoculation of the organism. Inoculation is to put in, okay? So, halimbawa, pagka sinaksakan ka ng injection, you are inoculated. So, meaning to say, a transfer of the organism, but it can also be passed on by sharing sex toys with an infected person. Symptoms, okay? The majority of infected individuals are asymptomatic. They do not present any symptoms at all. In women, the infection may persist for long periods, possibly months or even years. However, in men, it generally persists for less than 10 days, possibly due to the lack of estrogen. Symptoms that do occur usually following infection are not specific for TB and include so ibig sabihin nito, not specific for TB, the symptoms may present like a syphilis, a gonorrhea, or dysuria. So and then some discharges also or offensive odor. Okay? So there will be low abdominal discomfort, pananakit ng puson, bulbal ulceration, meaning pagkakaroon ng sugat in the vulva. Okay? So yan. Okay. So I think this is enough for us, enough information for us for our purposes. Hindi naman tayo magdodoktor. So I will just put it here, yung link, so that you will know where to look for further information. Okay, so natural and artificial methods of contraception. This is required by CHED that we discuss. This natural methods are abstinence. Simply abstinence, meaning to say that stop having sex. If you do not want to have children, then don't have sex. And then calendar method is kasi sa babae ito, no, in the menstrual cycle, okay, there are periods or days in a woman's menstrual cycle wherein a woman is fertile and there are days that a woman is not fertile. Okay, so let's try to see if we can find the diagram here. So you can have sex during the time that a woman is not fertile. Calendar method. So pagka ganon, it is safe to have sex. It is safe to have sex when the woman is not fertile. Okay, so let's see. So ito siguro. Okay. So 3 days before the period starts. 3 days before the period starts, kung kabisado ng babae ang kanyang menstrual cycle, so bago 3 days before the period starts, hindi na siya fertile. And then during this time that there is a period, syempre hindi rin siya fertile. Okay? So there are 10 days. Okay? 10 days. So 10 days that a woman is not fertile is 3 days before menstruation and during menstruation. So Wednesday, Thursday, Friday, usually 3 days. And then 1, 2, 3, 4, 4 days after the menstruation, safe pa siya. Now, yung 11th day, okay, these are the unsafe. This is the time when the egg is mature. So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So, every month, there are 12 days that a woman can become pregnant. So, that means after menstruation, bilang ka ng 1, 2, 3, 4. 1, 2, 3, 4 days. At yung panglimang araw, pwede na siyang mabuntis. Okay? Pwedeng mabuntis. Panglimang araw, 5th day after menstruation, no. After menstruation, Tama kung 3 araw ang menstruation, 'di ba girls, 3 araw. So after menstruation bilang ka ng 1, 2, 3, 4 days, and then yung pang-5 araw hindi na safe 'yon. Meaning to say kapag nagkaroon ng sexual activity dito, maaaring mabuntis na. Okay? So meron tayong red days 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, 12 na red days. Pagkatapos ng 12 na red days na ito, okay, pagkatapos ng 12 araw, yung susunod ay safe na ulit. Okay? So meron tayong 1, okay, 1, 2, 3, 4, 5, 6, 7, 8, okay? 8, 9, okay? So meron tayong 9 days plus ito. Paano ba binilang 'yon? 9 days. Hindi, no, no, no. Ito na yun yung before the period starts. Ito. So, sorry hindi ko masyadong maintindihan itong cycle ng babae. Pero ito yon. So, ang tandaan ninyo lang, ito na lang, no? Bago magkaroon ng period ay safe ang babae, no? So, ang pinakamahalaga dito maisip, hindi lang 3 araw, kundi 1, 2, 3, 4, 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 days. 9 days bago magkaroon ng period, safe ang babae. And then, mula doon sa araw ng period, 1, 2, 3, 4, 5, 6, 7, and then another 7 days na safe ang babae, kasama na yung time na meron siyang regla at yung susunod na 4 na araw pagkatapos na mawala ang regla, safe pa rin ang babae. So yun ang ano. Pero yung pang-4 na araw o yung araw 1, 2, 1, 2, 3, pagkatapos simula na magregla, 1, 2, 3, 4, 5, 6, 7. Yung pang-8 araw, wag na. Okay? Tigil muna hanggang sa bilang ka ng, again, ilan to? 10, 11, 12. 12 days. Itong 12 days na to, tigil. Okay? So, yun ang calendar method. So, both girls and boys, you should know that. Okay? Okay, bigay ko sa inyo yung link para mapag-aralan ninyo. Okay. And then meron tayong basal body temperature. Basal body temperature, there is a particular temperature na pregnant, ovulating at non-ovulating, okay? Basal body temperature method. So there is a particular temperature in the body So, if there is a rise in the body temperature at 0.3 to 0.5 degrees Celsius, it means that this is an ovulation period. Okay? So, the ovulation period, yung mataas ang body temperature. So, sexual intercourse should be restricted to post-ovulation phase only, meaning to say that when the body temperature falls again. So the limitation, abstinence for whole ovulatory phase, that is 14 to 15 days. So the woman is the person responsible for monitoring their body temperature. So this is another way to okay, to plan your family. Okay. So, yan. PBT, body temperature. I will give you the link. It's basal body temperature. And then the cervical mucus method, there is mucus in the vagina that it's produced in the vagina. Kapag ka ito ay, itong mucus na ito ay malapot at elastic, ang alam ko yun ay fertile. Pero kapag ka madaling itong maputol, pagka ito ay madaling maputol, ito yan. So ito yan. Pagka thick and creamy, lotion-like ang mucus, okay, this is the time that the woman is not fertile pala. Okay? Okay, so thick, creamy, and lotion-like, ito ay not fertile. Infertile, ito din yung malagkit, parang pandikit. Ngayon, pagka fertile ang babae, medyo watery, pero nai-stretch siya. Parang yung puti ng itlog. So, nai-stretch siya. This is the way with which you can distinguish the kind of mucus of an infertile and of a fertile woman. Okay? So, you have to check that. So, actually, the cervical mucus method, the calendar method, and the basal body temperature, you can do all those things para sigurado ka. So, para hindi ka magkamali. So, you can employ all those techniques. Then, we have the symptothermal method. Symptothermal method, I do not know how it is different from basal body temperature, but let us see. Okay, symptothermal method. So there is also a rise in temperature in the symptothermal method. Let's try to see it in the symptothermal method is a natural and healthy fertility awareness based method, or FABM, of family planning that makes use of a woman's observations of her cervical fluid, basal body temperature or waking temperature, and other biological signs changes in the cervix in order to identify the fertility, etc., etc. So yung symptothermal method is already a combination of cervical fluid and basal body temperature. Okay? And of course, siguro, isasama na rin natin yung calendar method. I will put in the link again. So pag-aralan ninyo pa more in depth. Okay. So go to a deeper. Okay, ovulation detection. Paano natin ma-detect 'yan? Ovulation detection. Actually, ovulation detection siguro is merong ovulation detection kit, okay? Ayan, okay? So you can use kits to detect if you are ovulating. So, bibili kayo ng kit na yon para malaman ninyo kung you are ovulating, ovulation detection. Then, meron din siguro na hindi kinakailangan ang kit. So, tignan natin. How do you detect? Okay. You can detect ovulation by way of looking at how sticky or how dry the cervical mucus. So, pareho lang din doon sa kabila, yung kanina. Okay. So, ovulation detection using body temperature. Okay. And then using the ovulation kit. All right. Okay. So, too much information already, ano? Coitus interruptus is simply withdrawal of the penis before ejaculation, and this is among all this natural family planning method. Okay, yung coitus interruptus ang tinitignan ng Christianity as immoral. Okay, but the rest are accepted by Christianity. 1, 2, 3, 4, 5, 6. Okay? These are accepted. Yung coitus interruptus, ang tawag, may another term dito in the Bibles is onanism. So ito ay, there is a story in the Bible na pinagbawal to. Galing kay Onan. Okay? Ito ay pre-practice ni Onan. So onanism ang naging ano. Okay, so we have oral contraceptives. These are pills that you take. Oral contraceptives. So there is different pills that you are taking. Ayan, ganyan. So these are already artificial means of these are already artificial means of uh, contraception. Okay, so may schedule yan eh. Yan. So there is a schedule right here. Okay, so meron itong for those days. All right, so iba't ibang pills for different days. So yan, artificial. So you have to take this oral contraceptive. Then there is also a transdermal patch. So as a patch, ito dinidikit sa skin. Okay? Sabi ng pamangkin ko, hindi daw ito widely practiced sa Pilipinas. So parang sa lompas siya. Okay? So this transdermal patch, how do they work? How do they work? I think it releases okay the particular drug through your skin that prevents you from getting pregnant. Okay, so kung ayaw mong uminom ng pills o ayaw mong uminom ng injection, you can use transdermal patch. Okay, and then another would be vaginal ring. Okay, so nakita natin vaginal ring is like an O-ring, malaking O-ring. Ayan, ito, yan, which is inserted inside the vagina to prevent passage of the sperm. Okay, so yan, ito yung vaginal ring. So once inserted inside, it will prevent the sperm from traveling inside further, that will make the girl pregnant. That's a vaginal ring. So ayan, it stops right there. It stops right there. So the semen will not be able to enter here and fail to ovulate. Okay, fail to anong tawag dito sa ano? Fail to fertilize the egg. Okay, it will fail to fertilize the egg dahil hindi ito makakarating. So, yan ang itsura ng vaginal ring. So, that's doktor ang naglalagay nito ha, hindi kayo. Okay. Ayan. Pero ito siya yung naglagay sa sarili niya, no? Pero when my niece was explaining this to my class, sabi niya, let the doctor do it, sabi niya. And then subdermal implants. This is the one that is common here in the Philippines. So merong implant na ilalagay under your skin, which is okay. No. Not that. For contraception. So simply, a subdermal implant is placed right there or to your non-dominant arm. Sa baba ito. So maliit yan. Ewan ko kung masakit. Masakit siguro, syempre. And then ipapasok doon, and for several days or for several weeks or months, you are not going to be fertile. Okay, so I think this is the I don't want to be wrong. Sabi dito, contraceptive subdermal implants are excellent method of contraception. The implants are small and rod-shaped. Contraceptive implants provide long-acting, highly effective, reversible contraception. So pag tinanggal yon, pwedeng magkaanak na. Non-biodegradable and progestins only. So progestins. This is a female hormone. Provides controlled release of progestin over years. The rods are implanted surgically into upper non-dominant hand. Okay, non-dominant arm. Ayan, kung gusto niyo makita. So siyempre meron itong nilalagay na anesthesia para hindi masakit. Okay? Hormonal injection, ito yung mga nakikita ninyo na nagpupunta sa mga para hindi umiinom lagi, okay? So yung hormonal injection, ginagawa ito sa mga rural health center eh. Libre yata ito eh. Ayan, so Depo-Provera, yon. It's a Depo-Provera. And how long does it last? I don't know. Hindi pa ako nasasaksakan yan. Babae lang pala sinasaksakan ito. Okay, this contraceptive injection, okay, every 12 weeks. Every 12 weeks. So, meaning to say, every 3 months. So, every 3 months, magpapasaksakan ito. Okay, so kumukonti na audience ko Ayaw na makinig. Okay, siguro kumakain na sila. Ako man, gutom na eh. Okay, hormonal injections, intrauterine device, IUD. Again, a doctor is the one supposed to put the IUD. So it is placed through the vagina and down up through the uterus. IUD. So right here, this is the IUD, okay? And then it is inserted through the vagina to the uterus, okay? And then it will expand right there, yung T. I think the way with which this IUD works is that it prevents the egg from going down here, okay? And of course, it stops the sperm from meeting the egg, okay? That way. Now, there is a theory that the IUD is not simply contraceptive, pwede din itong maging abortive dahil maaaring ma-fertilize yung egg, pero dahil dito laging ito nagpapawis, no, nagtutubig, no, nagtutubig dahil ito ay foreign body, and uterus is trying to expel this, of course. Magtutubig yan, hindi kakapal yung mucus, kung saan kailangan nito makapal at malagkit yung mucus para makakapit ang baby. So pagka ito, yung fertilized egg ay magta-try na kumapit dito, malalaglag yan at magiging parang regla. So ito ay parang pagpatay na rin sa baby. So ang tawag natin doon is abortifacient. Okay. And then we use chemical barriers. Chemical barriers, we use para mga spray, spermicide. to kill the sperm, chemical barriers, contraception for contraception. Okay, so these are different types of spray that you spray inside, or some base cream or jellies that you put inside. Uh, uh, I'm sure that these are okay. These are spermicide. Okay, tandaan niyo, IDE basta nagtatapos sa IDE, ibig sabihin ng pagpatay or instrument for killing. Okay, so this is spermicide. Meron tayo genocide, meron tayo insecticide. Okay, so these are pamatay naman ng sperm. Okay. So ayan, mina-murder mo yung sperm. Okay. I think it's bad. And then diaphragm. Diaphragm, let's look at diaphragm. Diaphragm. Ano spell nun? Diaphragm. Okay. Oops. Diaphragm. Tama naman. Contraception. Sa lungs to eh. Okay. I think we have to remove this diaphragm. Parang ano, parang condom to ng babae eh, no? Diaphragm contraception. Baka iba spelling. Okay, I cannot explain this correctly. Tanggalin na natin to. Cervical cup. Cervical cup, parang condom ng babae to. Okay? Makita, naituro ko na to eh. Cervical cup. Ayan, So, a cervical cup is inserted by a doctor. Okay, dapat doctor. And this will prevent the sperm from entering. Pero kung naka-enter dito, meron din itong spermicide, which is it will kill the sperm. Okay? Cervical cup. Then we have male condoms. Of course, you know that. Female condoms, para yun yung cervical cup na also. Okay? Female condoms. I think that is the same as cervical cup. Okay? Condoms. Ito yung female diaphragm. Tingnan natin to. Ayun. Okay. Ito yun. Female diaphragm. So, parang female condom din to. Okay? So, inilalagay at pangharang din siya. So, ayan. Tama yung nakita ko kanina. There is a spermicide and then this will prevent the entry. If may nakalusot, there will be a spermicide right there to kill the sperm. Okay. Then, female condom naman tayo. I don't see the difference actually. Okay. So, this is okay. So, this one looks like a condom but in the reverse, right? So, in the reverse. Okay. So, ayan. So, ipapasok inside the vulva. Okay. Ipapasok siya inside the vulva. Kung ayaw ng lalaki na mag-condom siya, so the babae can put in a female condom. Okay? And then, nagmamadali na tayo. Surgical methods. Okay. So, sa surgical methods, meron tayong tinatawag na ito yung surgical method is semi or even talaga permanent, no? Sa babae, ang surgical method ay tinatawag nating ligation, wherein the fallopian tube is cut and clipped, okay? Para yung egg sa ovary ay hindi na makalabas. So, yan. Or pinuputol siya, okay? So, tinatalian, yan, fallopian tube, okay? Tubal ligation or simply ligation. Okay, I hope you get this is clear to you. Okay, so they are banded and then they are cut and then cauterized, tied and cut. Okay, so these are the different ways with which a tubal ligation can happen. Okay, ayan. Okay, sa lalaki naman, ang tawag doon ay vasectomy. Vasectomy. Remember the epididymis, okay? The epididymis is directed to the vas deferens. The vas deferens carries the sperm to the urethra for release. So yung vas deferens na to ay pinuputol, okay? So pinuputulan. Pagka naputol na siya, wala na, hindi na makakaraan ang sperm, okay? So wala na. Kaya tawag dito vasectomy because ang pinuputol dito ay yung vas deferens. Look at that. So remember, this is the epidymus and then the epidymus brings the collects the sperm here and allows it to travel through the vas deferens. The vas deferens will pick up the liquid from the prostate. Okay. Egg yan, pinutol. Okay, puputulin yan. So that's vasectomy. So that is also considered immoral, okay? So in the Christian way, but not all Christians, sa Catholic, pinagbabawal to sa Catholic. Sa other religion na Christian, okay lang sa kanila, okay? So yan, surgical method. This is my personal note. The teachings of the Catholic Church on sex is clear. Sexuality is a gift, but sex acts are only allowable between heterosexually married partners, and each act must be both loving and open to procreation. So, the sexuality is a gift given to man by God. But as a gift, no, as a gift, the gift must be used in the right way. How would you feel if you gave somebody a chocolate pero ginawa noon sa chocolate na special at meant to be eaten ay ginawa lang na panghalo sa sampurado, okay? So parang underappreciated yung chocolate mo. Okay? O kaya ay itinapon lang, o kaya ay kumain lang ng kalahati at itinapon na o pinamigay sa iba. So in a way, sexuality, our sexual capacity is a gift from God. It is a very beautiful gift from God. But you can only use that only in situations wherein it is allowed. And what are those situations? Between married persons, man and woman. And when they do, it must be an act of the expression of love, and also this act of expression of love must be open to the possibility of having the fruit of that love or having children. Now, when one is done, so dalawang aspect ito, that the sexual act must be both loving, okay, an expression of love, and open to procreation. Pagka ito ay naging for expression of love only and not open to procreation, then you are actually, in a way, rejecting the fullness of the gift from God, okay, the gift of God. So, kinain mo lang yung kalahati, itinapon mo yung kalahati, which is an improper way of making use and receiving the gift of God. So when you use that, when you engage in that, and when you fully receive that gift of sexuality, kailangan tanggap mo lahat yon. That is an expression of loving, and then of course, the possibility of being given the gift of life by way of having a baby. Okay? So, kahit mag-asawa kayo, kung tinanggal mo ang openness to procreation by way of having ligation or vasectomy or artificial contraception, then that is a rejection to the openness or to the possibility of life. And in our Christian view, that is wrong or disordered, out of order. Okay? So, any other sex act is seriously wrong. So, when we say both loving and open to procreation, it means that the couple is ready to welcome a child as a fruit of the sexual act. Ayan. In this regard, the use of contraception listed above, specifically or specially the artificial means, are wrong and evil. Furthermore, some artificial means of contraception do not prevent fertilization, but it would not allow the baby to grow in the womb. Katulad nung sa IUD, maaaring ma-fertilize ang egg, pero hindi makakakapit yung fertilized egg inside the uterus dahil walang enough na lubrication inside, or yung lagkit o yung tinatawag nating mucus inside the womb. So, malalaglag ang baby. It means that these contraceptives simply make the womb hostile to the baby. And that is abortifacient, which is another word for abortion. Okay? Killing of an fetus, of an unborn person. What does that mean? Once the egg is fertilized, it is already a human being. This new human being cannot grow in a hostile womb and will eventually die. That is why it is called abortifacient. It kills the baby! Exclamation mark. It is a form of subtle abortion where mothers are usually not aware that they are complicit in killing an innocent human life. This is highly immoral and a disobedience to the fifth commandment of God. Sabi dito, huwag kang papatay. Thou shalt not kill. Then how about contraceptives that actually prevent fertilization? O yung effective na contraception na talagang hindi mape-fertilize. Sasabi natin, they are still disordered inasmuch as the sexual act should be both an expression of love between spouses and number two, openness to procreation. Sabi nga natin dito, itong regalong ito, kapag ginamit mo, kapag tinanggap mo yung regalong ito, dapat ito ay tanggap mo lahat ng aspeto nito, which is the expression of love between spouses and the possibility of having a child. With sexual acts that employ contraception that effectively prevent fertilization, the second element of it is eliminated, the openness to the gift of life. And as such, it may be considered disordered. Such artificial contraceptive methods include surgical approach, which is ligation for female and vasectomy for male, condoms, cervical cups, etc., etc. The rest may be abortifacients. Lalo na yung morning after pills, yung hindi ka nakagamit ng contraception, yung emergency use of contraceptive, hindi na yan contraceptive, yun ay spermicide already or abortifacient. Yung iinom ka ng gamot pagkatapos na nagkaroon ng aksidente na nag-sex na walang protection, iinom ka ng gamot, abortifacient yun. The church allows the natural method. So, pwede naman, tinatanggap na simbahan. The church allows the natural methods of contraception except for coitus interruptus o yung the removal of the penis just before ejaculation. In our class discussion, we have explained already how the calendar method works and other natural means of uh, controlling or planning your family, which is accepted by the church and does not reject the dual gift of the dual gift of sexuality. Okay, for our next session, which is 2 to 5, we are going to discuss uh, the second part of the module, to buy or not to buy. That is the question. And I think we will be able to discuss also the third part of the module. Do not just dream, make it happen. Okay? So I expect you 2 to 5. Oh my God. Okay, so let's make it 2:30. Please come back at 2:30. Uh, and I am going to explain or make it 2 to 2:45 para makapagpahinga naman tayo lahat. Okay? So I am going to explain the two other topics. Okay? So that will be ano muna tayo? Lunch muna tayo. O kung nakapag-lunch na kayo, ako hindi pa ako nagla-lunch. Okay, so thank you for listening. Thank you for joining me